Okay, now a very good morning to everyone, to all the lecturers and students. So for today, we are going to um, talk about interprofessional collaborative practice, or we normally use the terminology, yeah, interprofessional collaborative or collaborative practice. So our learning outcomes upon the completion of this lecture, the students will be able to explain the definition of IPCP, importance of IPCP for pharmacists and patients, models of IPCP, and also challenges to develop IPCP. And I also will add a bit about the interprofessional education. Yeah. So the next, I want to ask whether can pharmacists practice alone without interacting with other health professional? So let us see the answer. So what is the answer? So 5% said yes and 95% said no. Can you see the screen? Yeah. Now
Can.
10% said yes and 91 said no. So may I know why you say yes, why you say no? Can any volunteer? Any volunteer, please? Why do you say yes? Why do you say no? Siapa who just now answered yes or who answered no?
For me, I answered no
Yeah.
because as pharmacists, generally we have to work with doctors. Like because we are only like experts, I mean supposedly experts in drugs, whereas doctors are the ones like for example diagnosing. So there has to be interaction, especially like nurses. They are the ones that are monitoring the patient. They're the ones closest to the patient. So it's unlikely that we will not have any other interaction. Even in under other industries like the industrial pharmacy, we still have to work with the, for example, technicians. So
Mhm.
it's, yeah, that's why I answered no.
Okay. So there are a few students answer yes. May I know why do you answer yes? There is no right or wrong, yeah, here. For the sake of discussion, please answer. We won't say that you are a bad or you are good students. We want to learn from you as well. Anyone say yes just now? Because 90% said no, but there are around 9% said yes. So what do you think? Because I want to know the opinion. Why did you say yes? There is a student called Rashid. Is a student Rashid? What was your answer, Rashid? Bu Enti, can you hear? Huh?
And everyone open your camera so that we know that you are join this session or not. Okay, where is Rashid? Rashid, are you there or not?
You don't know. Okay, so those who answer yes just now, could you give us your idea why did you say yes? Or maybe probably you just type wrongly or what? I don't know. It's okay if you say that. Oh, I choose wrongly. Anyone?
It's okay. We learn from the mistake, right? Whether it's
Yeah.
correct or
No,
not.
there is no right or wrong. Yeah. So
There is
like
no right
this.
or wrong
Yeah.
because its answer is best opinion.
Yeah. Anyone? Just now who answered? Yeah. Didn't mention the name just now. Who answered? If you want to
Um,
answer, yeah.
I answered for no just now.
Who was
Yeah,
it? Ada
join,
ya?
join,
Huh?
Joanne Carmen.
Joanne.
join,
Okay. Hi
join.
Joanne.
Final year student.
Final year.
Mm-hmm.
There was a Joanne before that when I did this
Yes, the
liquiding.
Tang Joanne.
Huh?
Tang Joanne. Another one.
Another Joanne, yeah. Okay. All right. So final year means what? What semester? Semester 7, yeah.
7.
Okay. So semester 7, have you gone to hospital attachment?
We're doing the virtual one with our lecturers because we
Oh,
cannot go.
They are very lucky. Just stay at home
okay. Yeah,
this semester.
but I don't know whether it is lucky or not lucky, yeah, because because go
Supposedly,
yeah, go to hospital is a good thing actually. Yeah.
yeah, not lucky lah then.
Oh, just now Joanne Carmen Russell, is it?
Yeah.
Yes.
Yeah, okay. Okay, so since you're already final year, right? Please be more brave, yeah. Yang junior-junior ni malu, malu karena ada senior ya. Ya Hana, malu ya.
Yes.
Sepatutnya senior yang malu sebab kalau salah takut sama junior kan. Kalau junior salah tak apa. Ya, because you are junior kan. But okay, so there is no wrong and right as I say. Yes, okay. Most of us will say no, yeah, but a few say yes. But I don't know why because nobody wants to speak up. Yeah, so I think consensus we say no because even though you are in community pharmacy, so right at the moment, our community pharmacies, yeah, in Malaysia, do you think they already collaborate or not? There's a chat. Camera problem. Okay, camera problem. It's okay if you don't on your camera. I don't understand. But if you want to speak, please speak up, yeah, so that we can our discussion can be forthcoming. Okay. All right. So let me share back our slides. Okay. So now, do you see the slide now? Yeah.
Yes,
Yeah.
Yes.
Okay, so terminology that we normally use, yeah, is interprofessional practice (IPP), yeah, or multi-professional practice, collaborative practice, and interprofessional collaborative practice. All right. So interprofessional practice is a collaborative practice, yeah, which occurs when healthcare providers work with people from within their own profession. Yeah, so among within their profession first, do you think within a profession there is a sub discipline or not? So we are talking about discipline and profession. Yeah. So profession, like a doctor, pharmacist, we are two different professions, correct or not? Yeah, nurses, physiotherapists, we are two different professions, okay? But when you talk about discipline, yeah, discipline within profession like medicine, do they have different disciplines?
Probably yes.
Yeah, so what are the discipline in medicine, for example? The discipline in medicine.
As if I know.
Hello?
I do
Uh,
not know.
okay, apa? So, Madam NT, Madam NT, ada, can I make you
Yes,
as
yes.
a co-host? Yeah, I make Ada as co-host.
Sure, can, sir.
Yeah, and NT mana NT? I make you as co-host ya. So when a student answer, can you apa namanya tuh pinpoint ya? Apa namanya? Spotlight the
Okay.
student ya. So because I don't know who is answering.
Okay, okay, okay.
Yeah, maybe also one of the student I can make a co-host. Siapa? Joanne, I make you co-host ya, Joanne. If you want to call your friends to answer, you can spotlight them and ask them to answer. Yeah. I make Joanne as co-host. You point your friend and ask them to answer. Yeah. For semester 5 students who I can ask to be co-host. Mana tadi Hana? Oh yeah, before that, there are also some of our students from Jakarta is also joining this session. Yeah, welcome to them all. Yeah. Siapa lagi tadi? Mana Hana? Oh Hana, I make you co-host for your group. Yeah. So if you think your friends want to answer, you just spotlight them. Okay, dear. Okay, just now, for example, for medicine, yeah. So you said that there are different disciplines. What are the disciplines in medicine, for example?
Cardiology.
Yeah. Who is answering? Can you spotlight the one that answering?
Sandrika sir.
Sandrika.
Yeah. Spotlight. You know how to spotlight? Go to their picture and then you spotlight like that.
I already spotlight her.
I cannot see.
Oh, really?
Yeah. Is it because we have
Spotlight
to?
video, right?
Yeah.
Yeah, I click already on her.
Okay. Maybe I have to see. Can you spotlight?
I already.
Try. Yeah. We try.
Already lah.
I did already just now. Okay.
Okay. So,
Is this how?
what is your name?
My name is Sandrika sir.
Sandrika. Okay. Happy Deepavali ya, belated.
Thank you sir.
Yeah. So what was your answer just now, Sandrika?
Cardiology.
Cardiology, and then what others?
What is dermatology?
Yeah. So there are so many, right? Gynecology, yeah. So if you go to hospital, yeah, you go to the ward, okay, and then normally in medical ward, patients will have different diseases, yeah, like kidney, heart, yeah, liver. So there are certain specialists, certain team, yeah. So then they will refer this patient to a certain, for example, patient with psoriasis and also got kidney problem. So the doctor in the ward will write a referral, yeah, ask the dermatologist to come. Yeah, then the dermatologist will come and see the patient and they will write something, yeah, in the patient progress note. Okay, so these are collaboration among the one profession but different discipline. Yeah, and for pharmacy, do you think pharmacy have different discipline or not? Pharmacy have different discipline or not? Siapa jawab?
Yes.
Who is that?
Oh, it's me.
Coagulant ya, coagulant ya.
Yeah.
Coagulant. Okay. So what are the
There's
disciplines?
3 disciplines, right?
What are the disciplines in pharmacy?
Pharmaceutics, pharmacognosy, and medicinal chemistry.
Okay. Yeah. So these are the examples of the disciplines in pharmacy. Yeah. So how
Yeah.
these interdiscipline people work, for example, in within the pharmacy itself?
Oh, that I do not know. I don't work in a pharmacy.
So, for example, if you are community pharmacist, and with the hospital pharmacist, do you think they can collaborate?
No,
No.
no, not no. I don't. They're not in the same setting, right? If a community pharmacist with the hospital pharmacist, right? Because they're in 2 different settings completely.
Yeah,
Or
but
can they?
can they collaborate?
If they're in the same setting, yes. But not, then no, I don't think so.
Mm-hmm. And how about in industry? For example, industry, you imagine a drug company, yeah. So the pharmacist will work in different section, right? Some will work in the lab and the quality control. Some will work in the production. So how they collaborate?
I'm not sure about that.
Yeah. So you see, yeah, from your answer, maybe we can ask other students first to answer. How pharmacists collaborate among this discipline? Call the other friend. Joanne or siapa? Whoever wants to answer, yeah, no need to yeah, just answer. Give some additional view from Kogulan. Thank you, Kogulan. You volunteer to answer. Yeah. Thank you. Nandri. So you still wearing mask every day at home as well?
Ultimate protection.
Okay. So better to prevent than to cure. Correct. Okay. Siapa ini? Please. Hana, please you select your friends. Nah, Fida dah senyum-senyum tu. Fida, answer. Can you answer, Fida? Unmute first, unmute.
About the collaboration between physicians and other
Among pharmacist discipline, yeah.
I think if they do sort of like a campaign for the patients, maybe that's where they can work on the collaborations. But I'm not sure like about specific answer.
You mean have campaign, yeah, have campaign.
Yeah, like maybe they combine among the pharmacies itself and make a campaign, but not only community pharmacies, but also include hospital pharmacists also. It's like a joint campaign, but yeah, I only tried my best. I don't know what's the correct answer.
Yeah. Okay. So you see now from the answer. Maybe I invite one more senior ya. Just now two and junior, right? So senior jangan kalah dengan junior ya. So you all answer please.
So I have an opinion. Like
Yes.
okay, because we know that patients they don't come with only one problem, one disease. They
Yeah.
come with multiple disease. So when each pharmacist have their own discipline, they will
Hmm.
need to maybe collaborate to treat the multiple disease being experienced by the patient. So they will need to collaborate among each other, even though from
Okay.
different disciplines.
Okay. So what are the discipline in pharmacy you think?
Um, I am not so sure, but according to my reading, it's pharmacy practice, medchem, pharmaceutics. That's all I remember.
Yeah, but in term of the, I mean that your answer is theoretical, correct? Yeah, but in term of practical, can a pharmaceutics person or chemistry person involved in the patient care?
Maybe not directly,
Mm-hmm.
perhaps indirectly.
Okay, so thank you for your answer. But you know that in the patient care itself, yeah, the hospital pharmacist, nowadays pharmacists also be specialized. Yeah, so there are some pharmacists are in cardio, yeah, some pharmacists are in endocrine, yeah, like diabetes. Some pharmacists are doing specializing in pediatric, yeah, some are in geriatric, and then some they are specialized in kinetics. Yeah, not everyone love kinetic, right? So you already study kinetic, the whole class, everyone love kinetic or not? Be honest.
Not really, sir.
No.
Not really. Just to know is okay.
uh, yeah, so so you see, yeah, so like in the hospital, yeah, you have TDM unit, yeah, and TDM unit, they are day in day out doing the calculation. Yeah, those pharmacists in the store probably already long time never calculate the TDM. They probably, yeah, most probably forget about the equation already. Yeah, so they will have to, when they are rotated, for example, in the ward, yeah. So if there is a clinical pharmacokinetic questions, they will have to consult their friend, right? So these are the example of how pharmacists work in among themselves. Yeah. So you have the drug information pharmacist, where they can find information faster because they know where to find. Yeah. So just now, actually, you see, for your answers, you have 3-4 answers just now. Pharmacists themselves, we pharmacists ourselves, have difficulty to work among us. Yeah, to know how we can work among us. Yeah, correct or not? Yeah. What about among with others? Okay. So, for example, between community pharmacy and hospital pharmacy, yeah, so there should be a link, correct or not? Yeah, there should be a link. For example, patients are being transferred back to the community, to their already discharged. Yeah, supposedly they are closer to their community pharmacists. Okay, so the information from the hospital can be passed down to the community. Yeah, similarly, those being admitted to hospital, probably they have been going, purchasing their medicine in the community pharmacy. So the hospital pharmacist can ask the community pharmacist, right? So vice versa. And community pharmacists knowledge are very general, but the hospital pharmacists are more in depth. Yeah. So for example, for certain drugs, maybe cancer drug or certain drug that are not available in community, but the patients are using, probably the community pharmacist can contact the hospital pharmacist to ask. Yeah. So these are collaboration among pharmacists, and you have industrial pharmacist, yeah, can give some education, yeah, about new drugs, for example, new products, yeah, and vice versa. And in the industry in the industry, of course, you can see more collaboration among these pharmaceutics people, yeah, because the pharmaceutics expert normally they work in the R&D, right, research and development, yeah, and within those in the community or in hospital, they will say to the people in the industry, oh, actually we need this drug, yeah, in liquid form, for example, yeah, for example, this drug we don't have in liquid form, yeah, can you please formulate in liquid form? Okay, so these are all collaboration among the pharmacists. And the chemistry people, normally they work in the university, yeah, they find new molecule, yeah. So among the profession, so with people outside their profession and with patients and their families. So it's important also patients and their carers. Okay. Now, why do we need to collaborate? Yeah, why do we need collaborations? Can you? This is a word. Wait. Oh, actually, Zoom can poll as well. No man. Let me try this one. Why do you think you can you figure out the answer, and we will do this is this is a word cloud, yeah, so we can see the word cloud. Are you able to enter to the quiz?
I think you haven't activated because it said waiting for your presentation to begin.
Okay.
Okay.
Now can I? Now can?
Can.
Can, sir.
Okay, sorry. Okay, we can see some words are coming now. Why do we need collaboration? Okay, let's see. I'll just log the, because I saw a lot of response already. So we log the response first, yeah, and I show the responses. Okay, show the responses. Oh, show responses. Okay. So these are our response, yeah, better outcome. And then reduce apa? Reduce apa ini ya? Provide mortality, maybe ya, reduce error, ya, teamwork, morbidity. What is morbidity? Ya, understanding, apa ini? Given, prioritize, intervention, outcomes. So these are the words that you type, yeah. So for here, better patient outcome is the most one. Okay. Reduce harm, probably, yeah. Reduce error. Okay. Improve outcome, I think, yeah. And what? Enhance understanding, yeah. Discipline, medical outcomes, intervention, prioritize, desired. Okay, so these are a few words that you have typed. Okay, holistic, needed. So anyone want to comment about this? From your answer just now, yeah. Why do we need collaboration? Maybe one person from SEM 7 and one person from SEM 5. Tolong Joanne, you select your friend answer. Siapa ini? Putri. Putri SEM 5 kan?
Yes, SEM 5.
Yeah.
My answer is different discipline have different specialty, so collaboration is needed to produce a better outcome.
Okay,
Especially
so
in patient care.
all right, good. So any other benefit? Any other benefit? Okay, coba yang semester 7. Semester 7.
We need to collaborate to improve the patient outcome. And also by improving the patient outcome, the mortality and morbidity can be reduced.
Okay, so we reduce mortality and morbidity, yeah. So it means outcome lah kan, better outcome, yeah. Any other things that you want to add?
Other than that, it can by collaboration we can actually reduce the drug adverse reactions being experienced by the patients.
Okay, good. So can you give me example how collaboration can reduce error? Yeah, how collaboration can reduce mistakes or error, adverse reaction. Or you mentioned about adverse reaction. Yeah, how collaboration can reduce adverse reaction.
Maybe, sir, it's because, like, let's say the doctor makes a mistake in the dose, and then the
Yeah.
pharmacist checks up on it, and then he corrects him. He advises him on the and modifies the medication therapy,
Okay. Good.
something like that.
Yeah. So do you think it happens quite often?
Yes.
Yeah.
Yeah, but there are also doctors correct, but pharmacists or pharmacy assistants dispense wrongly. Yeah. So not only the doctor's mistake, but pharmacists also can make mistake. Yeah. So everyone can make mistake. So if you have another pair of eyes to check, it's always better. Correct or not? Yeah. You yourself, when you have teamwork, yeah, sometimes you think, oh, I'm so good, my English is so good already, right? But still you can have the spelling error. Correct or not? Yeah. And when you find your spelling error, alala, kenapa lah buat spelling error, ya? So memalukan kan? Your English is A plus, but then you still make a very silly spelling error. That happens to us, all of us, ya. Happen to me as well, ya. So nanti bila orang jumpa, so this is wrong. Then we, oh my God, I didn't see it. Correct or not? Yeah. So it's always and I will show you this story. Yeah. You like story or not? Do you like stories?
Sure.
Now, okay, before that, before go to story, yeah. So we mentioned about a lot about interprofessional team and multidisciplinary team, yeah. So that actually there's a difference between interprofessional and multidiscipline, yeah. So what is the difference? Okay, interprofessionals, yeah. So this profession, yeah, will work together. Okay, there is a apa namanya? There's this is the Venn diagram. Yeah, Venn diagram. This is the patient. So there is the area that you collaborate. Yeah, you work together. Okay. But for multidisciplinary, it can be interdisciplinary, but it can also work among the discipline themselves. Yeah. Just now I mentioned that in the hospital there are many teams. Yeah, the renal team, the cardio team, the dermatology team, yeah, the pharmacy team, the physiotherapy team, the nursing team, yeah. So what happened, for example, the doctor or the pharmacist, like we'll talk about pharmacists and doctors, for example, yeah. And the doctors, when they find out that the patient cannot use inhaler, yeah, or the inhaler technique is wrong. So the doctor said, can you please inform, tell the nurses, yeah, can you please inform the pharmacist to teach about the inhaler, correct inhaler technique to our patient. Then the nurses said yes, yeah. Then the nurses informed the pharmacist. Then the pharmacist came to the ward, yeah, and then teach the patients how to use inhaler, yeah. And then the pharmacist write in the notes, yeah, I have already give education about inhaler use. So do you think this is interprofessional or multidisciplinary? Which one? Interprofessional or multi-professional? Do you understand what I mean just now? Huh?
Is it multidisciplinary?
Yeah, who was that?
Hannah.
Hannah. So so yes, this is more of multi. Yeah. So you you do it for your among you only, right? And of course the doctor asked, but then you didn't have interaction with the doctor. Yeah, your interaction is through the patient. Okay, through the patient, not directly the doctor, right? So let's say the pharmacists, the doctors, yeah, and the nurses and all this profession, they are together have in the round, yeah, in the round. So they go in the morning, go together to the patient, yeah. And then the pharmacist find out that, oh, the patients cannot use inhaler well, yeah. And then the pharmacist suggests to doctor, okay, doctor, I think the patients cannot use inhaler. The technique is wrong, so I will teach the patient. So there's active, yeah. And then doctor said, yes, you please teach the patient. Then later on we will discuss, yeah, whether we have to change the drug or not. Okay, so these are what
Interprofessional.
Yeah, interprofessional, yes. So so multidisciplinary is not bad. Yeah, so it's already a step ahead, right? Yeah. And so there's a recognition of pharmacist role. Yeah. But it's still we are still doing it separately. Yeah. So you ask Miss Auntie and the lecturers, yeah, that go to hospital. Mainly our hospitals now, they are multi-professional, right? So the doctors will write to the dermatologist, yeah, please kindly have a look at this patient, yeah. And the dermatologist come and then have a look and then give the drug, yeah. Then the neurologist give the drug, and then the cardiologist give the drug. So everyone give different drug to this patient. Yeah. So these are all multidisciplinary without any agreement. Yeah. So for example, like if dermatologists give drug, they will not ask the doctor that in the ward, yeah, whether we can give this drug or not. Yeah, because their own profession, so they have their own what do you call this autonomy, yeah, to give the drug. Yeah. So let me tell you a story. When I first became called clinical pharmacist in the hospital, yeah, I was a young pharmacist that time, yeah, and then when I entered the hospital, did not have any clinical pharmacist, right? So I said to my chief pharmacist, yeah, give me 1 week, I will notice, yeah, what I can do, what can I contribute to this hospital. Then after 1 week, I wrote a letter to her, my chief pharmacist, and to the director of the hospital. Yeah, I said that I want to develop a clinical pharmacy practice in this hospital. Yeah, for example, like patient counseling, yeah, giving drug information, etc. Then my chief pharmacist said, "You gila ya." She scolded me. She said that you you ask for problem, she said, yeah, you if let's say if you make mistake when you give counseling to the patients, yeah, what will happen if you give you if you know, because that time very very long time back, yeah, 20 years ago, yeah, more than 20 years ago, you are not born yet or you're still baby, yeah. So the clinical pharmacy is not yet developed, and then the pharmacist just do all the filling the prescription, yeah, all this logistic, yeah, stock in the hospital. So they don't go to the ward. They didn't go to the ward, so they cannot imagine what I wanted to do, right? But because I wrote this proposal and I sent it to ICC it to the director of hospital, and the director of hospital CC it to the medical committee, yeah, so the doctors committee, yeah, and the pharmacists themselves didn't take it up, they don't want, yeah, but the medical committee, when they saw my proposal, that time no email, yeah, no email yet, yeah, so when they see they read my proposal, straight away they contacted me, yeah, they said that, Benny, can you come to the ICU tomorrow morning at 7 o'clock, because we have a patient that need your help. Yeah, my goodness, I said, I just want to start, yeah. And normally we will start in the like diabetes lah, hypertension lah, yeah, easier lah, yeah. And straight away go to ICU, yeah. I also takut juga, yeah, so I also feel very dreadful also, yeah, scared. You go to ICU, yeah, but what to do, because I already made the proposal, yeah. And then when I went to the ICU, there was a medical student, third year medical student, yeah. She was hospitalized for 1 month in the ICU, yeah, because she went for a camp with the medical students, and she developed because of their camp in the they pergi naik gunung, ya, naik gunung. So they didn't drink enough, so dehydrated, and she developed acute renal failure. Yeah, and then now because her father was a specialist and a professor in anesthesiology. Yeah, so when you have a father professor like that, so other professors, the best doctors in the hospital, they all came in to help. Yeah, so you name it, there's a nephrologist, there's a cardiologist, there's infectious doctors. Yeah, everyone there, yeah, with the ICU doctors. So everyone is giving medicine. Yeah, so she ended up using 20 over medicines. Yeah, so 3-4 antibiotics like that, and nobody dare to say, okay, this medicine I think not enough, not for now, maybe we can, and those medicine, yeah, it's not good for this or that. So nobody say like that. So she ended up with 20 over medicines. Yeah, and then when I started, invited in the team, and the patient is already 1 month in ICU, and literally I don't know what to do, because there are 4 big bundle of patients' medical record there. Yeah, because ICU, they write a lot. Yeah, one day it can be like 10 pages. 1 month means like 300 pages. So, and now this morning at 7 o'clock, what can I do? Right? To read all the 4 volumes of this, it will take me like a few months to read. Right? And I was just a young pharmacist. Yeah, I don't have knowledge. Okay, not enough knowledge. But just because, what do you call it, this apa namanya, my, because I was young. Yeah, so when you were young, you take the risk, right? Yeah, you took the risk. So I took the risk. I said yes, let me figure out. Yeah, so I consulted my senior in another hospital. So my job literally was just to stop certain drugs. Yeah, because she had got she had like 4 antibiotics, right? So with antifungal and etc. So I just said that maybe we should stop this antibiotic and we should use this and that instead. Yeah. So when I joined the team, yeah. So Alhamdulillah, within 2 weeks, yeah, this patient got well and discharged from ICU to normal ward. And within 1 or 2 weeks, then she could discharge completely. Yeah, and the father was so happy, and he said that, before that, they have like lose hope already. Yeah, for this child. Okay, and I think this is a good for me also. Yeah, myself also, it boosted my confidence, right? Yeah, to be a good pharmacist. So I always remember that was my first case in the hospital, in the ICU. Yeah, and how when multidisciplinary team, yeah, it's already good, but it's not good enough because they don't talk to one another. Yeah, although we had, after when I joined, after that we had a multidisciplinary team meeting every 7 a.m., 7 a.m. in the hospital, almost every day. So that time I didn't understand what is the difference between interprofessional and multi-professional. Yeah, but now I understand. Yeah, so we have to talk to one another. Okay. So WHO have the documents, yeah, as early as 2006, working together for health, yeah. And also, if you have time, you can browse this, yeah, framework for action on interprofessional education and collaborative practice. Okay, so collaborative pharmacy practice is the advanced clinical practice, yeah, where pharmacists collaborate with other healthcare professionals in order to care for patients, carers, and public. Yeah. So this is in 2009. You know what is FIP or not? Yeah, FIP, International Federation of Pharmacy. Yeah, is the world highest pharmacy body. Yeah. And that time, 2009, yeah, their definition is advanced clinical practice, yeah, such as advanced thing, yeah, collaborative practice, right? But actually, collaborative should be a normal practice, correct or not? Yeah, should not be advanced practice, because advanced practice means, wow, Yeah, not everyone can do that. It's only advanced. Yeah, but in fact, in normal practice, yeah, in community pharmacy or hospital pharmacy, wherever you practice, you should inculcate the principle of collaboration, correct? Teamwork, yeah. So even though it is in the pharmacy, community pharmacy, normal community pharmacy, yeah, we should already develop the collaborative practice. Agree or not? Now, another story, yeah, in healthcare, yeah, have you heard about this? All the medical students, yeah, when they graduate, okay, they will have the oath, kan? Yeah, the oath taking, yeah, and the oath taking is called what? Hippocratic oath, yeah. Hippocrates is the father of medicine, yeah, in the West, right? In the East is Avicenna. You know Avicenna? Yeah. So in the West, Hippocrates, yeah, I think it's Greek. Yeah. Now, so this Hippocratic oath, the first apa namanya? The first ayat dia, yeah, the first sentence is do not do no harm. Okay, so before the doctors or the pharmacists, whoever, yeah, can can contribute to the healing of the patient, curing the patient, first we do no harm. Yeah, don't make it worse. If you can't make it well, don't make it worse. Yeah. Okay, so so this is the story. Yeah, this gentleman, Ian Gilbert, yeah, he has got psoriasis. Do you know what is psoriasis, right? Yeah, skin condition, psoriasis. Okay. Now, so he was given, yeah, psoriasis. Yes, he was given. This is quite recent case, yeah, in 2015. So only 5 years ago. Yeah, it's quite recent, yeah. So he was 77 years old. Okay, and no, the skin disease psoriasis. Can you die of psoriasis? Do you think?
No, I don't think.
Yeah, very seldom, maybe 0.001% lah, yeah, died of psoriasis. Yeah, maybe if you have psoriasis plus arthritis and other disease, probably, yeah, but not the psoriasis itself. Okay, but what happened? He was prescribed methotrexate, yeah, because methotrexate is one of the gold standard, yeah, for all this autoimmune disease. Okay, and if you check in BNF, yeah, methotrexate 7.5 milligram, yeah, every week, once a week, yeah, every 7 days, yeah, so every week, one tablet a week, yeah, once weekly. Okay. Now the doctor prescribed that dose, yeah, but for every day. Okay, instead of once weekly, the doctor prescribed one daily. All right. And then actually the community pharmacies, because in Australia, yeah, the doctors cannot dispense, yeah, and the community pharmacies pick up that prescription. Okay, unfortunately, okay, the community pharmacies call the doctor, yeah, to check, yeah, whether this is intentionally or not, yeah, this high dose for one daily, yeah, and the doctor answer yes, he wants it to be once daily. Okay, and the pharmacist reminded, but the doctor said just give as I wrote, yeah, and then the pharmacist no choice, just give the medicine like this. Okay, so after taking these medicines, and the patients fell into renal failure, yeah, kidney failure, and eventually died. Okay, then after that there was investigation, yeah, and then of course they were blaming, right? The doctor blamed the pharmacist, saying that you are the pharmacist, you call yourself, just now one person said, who said this, there's no Sandrika, yeah, we are the expert of drug. Yeah, you call yourself the expert of drug, why didn't you insist? Yeah, why did you dispense? Okay, And then the pharmacist said, yeah, I already pick up the error. Yeah, and then I call you, but you asked me to dispense accordingly. So this is what I did. Okay, so now for this case, can you, what do you think of this case? Whose fault actually, from your point of view? Macam mana ni? We almost 1 hour already ya. Do you feel boring already?
No.
Huh? Tell me frankly, we can stop if you feel you think boring. I think
Oh, sir,
you
not
should be
boring.
more interactive than not boring, yeah. So if you just listen, then you will be bored. Okay, can I ask for discussion or even debate on this matter? What do you think? Whose fault? Can the class? I mean, there's now Hannah and Joanne. Help me to appoint your friend to answer, please. Just spotlight them so they will answer. Yeah, by force. Biasanya, if a class no, I mean if these are not tested in the exam, the students become lazy ya. Don't want to listen lah. Tak ada dalam exam. Like that ya. So are you like that or not? What are your real exam actually? What are your real exam? What is your real exam?
Life.
Yeah, your real exam is when you work with the patient. Yeah. So that is the most important, is the your knowledge. Yeah, not to pass your paper-based exam or now computer-based exam. Yeah. All right. So anyone want to give your opinion? Whose fault is this? And as pharmacists, what should we do? How can we do? How could we prevent this?
Both of them wrong.
Siapa ini? Spotlight, please. Oh yeah, wait. I stop the share. Okay. Oh, ada. We have a cat here. Syafika ya? Siapa ini?
Syafika.
Syafika, tak boleh ini ya. Video tak boleh.
Wait.
Not working. Tak apa. If you, sebab I know sometimes the student belum siap lagi. Ya, tak apa. So you just answer.
So I think both of
Mhm.
them wrong because
Uh-huh.
first of all, pharmacist is their job to make sure that the drug they give is correct. And then the doctor's fault also because in healthcare, in hospital, usually doctor is the leader. So plus the pharmacy already correct it. So I think both of them wrong.
Okay. So both of them wrong, but whose mistake is more?
Doctor.
Doctor. Okay. So anyone else yang different thinking, different opinion?
In my opinion, I think both is wrong because like similar to what she said just now, the doctor has prescribed the wrong, for example, the wrong medication or wrong dose or whatever. The pharmacist has the responsibility to, well, obviously to advise to change it. And if the doctor does not want to change, technically speaking, we don't have to fulfill that prescription if we don't agree with it, especially if we know that it's wrong. So I mean, the pharmacist is the last barrier in the sense that to avoid this from happening, since the doctor does not want to agree. If doctor wants to, wants the prescription to be filled, he just has to go to another pharmacist, I think. That is what I would have done if I was a pharmacist. Like, if I don't agree with it, I wouldn't fill it. So, yeah.
Okay. Yeah. So now we have two opinion, not different, but slightly stronger. Joanne slightly stronger, feeling that pharmacists should not have dispense it, right? So maybe we ask the third person. Third person, please.
I want to talk, but maybe my background will be quite noisy. I think both are wrong, of course, but as Joanne said just now, better the pharmacist didn't dispense and then ask because we already tell the GP to the wrong dosage and all. So better to ask the patient to come to the doctor again and get diagnosed. Maybe the diagnosis is okay, but maybe if the doctor see the patient again and consider it, maybe better dose can be given. That's all
Yeah.
for me.
Yeah. All right. So okay, thank you so much. Yeah. So I think just as I mentioned, there is no right or wrong here. Yeah. But of course, it is if we are in the patient's family's eye, yeah, it's always sad, very sad, isn't it? Yeah. So for me, I would say I would agree with maybe Carmen and Hannah. Yeah. So, but I would be a bit stronger, saying that we shouldn't dispense that. Yeah, and you shouldn't also ask other pharmacists to dispense it because we know it's wrong, right? And then if the dose is really we out of normal dose, yeah, and and as a pharmacist we already can foretell that the doctors actually wanted to prescribe once weekly, but they probably write one daily out of mistake, and probably the doctor don't want to admit the mistake, yeah, in front of pharmacists, right? And probably doctor just like shy to admit the mistake. And then here the pharmacist also was okay, I already technically, yeah, I think in law, yeah, the pharmacist will not be prosecuted because she or he has already contacted the doctor, and in law uh, she or he already fulfilled the what is expected, yeah, contacted the doctor and the doctor insisted, and pharmacist's role is to dispense according to the doctor's instruction, yeah. So clearly I think eventually when they have this because they have the court case of this, if I'm not mistaken, the pharmacist was acquitted. It means that the pharmacist was not being what do you call being charged, yeah, because she or he already fulfilled the procedure, yeah. But that is the procedure. But in terms of more than that, yeah, because I think the pharmacist should stand up, yeah, and should correct and stand up, yeah, and then should, if the doctor still insists, the pharmacist should go to the doctor's head of department probably, yeah, and to explain it, okay. So should not just dispense and say, oh, okay, I already fulfill, I already discuss with the doctors, yeah. Do you agree with me?
Yeah.
Yes,
Yeah.
sir.
Yeah, because this is the patient's life, yeah. uh Madam NT, do we need 5 minutes break?
Can.
Can, yeah. All right,
Can.
so we have 5 minutes break lah, yeah. So while having break, I will play something, yeah. So those who want to have drink or go to the toilet is okay, yeah. So So the rest can watch this clip, yeah. Okay.
Is it moving?
Yeah. It's a clip, yeah, about this near
Okay.
fatal case. Okay. Can you hear?
I'll never forget the day that my 4-year-old son Logan almost died in my
Yes,
arms
sir.
at Royal University Hospital. We were sitting on his hospital bed when he let out a scream. And I knew that he shouldn't be screaming because he shouldn't have been in any pain.
A bag of potassium, concentrated, heavy concentration bag, was hung instead of a diluted bag.
As a pharmacist, I know that when the concentration of potassium is too high, that it can burn. So I knew when I looked behind me and saw potassium hanging, that the concentration Logan had been given was too high for him, and as a result could have killed him. I immediately locked his IV and I started to cry and shake with all the chaos going on around us.
I went over to the bedside and saw that she clearly was upset about something.
And he looked right at me and he said, I have no idea what you're talking about, but I trust you and I know that you know there's something wrong. I'm here to help. Let's figure this out.
Down to the OR waiting room where we met up with the anesthetist, and come to find out he didn't even know that Logan had a kidney condition. He wouldn't have required us to increase the potassium if he had known that.
I firmly believe that everybody that day was working with my son's best intentions. I work in the system myself, and I saw errors. I've been involved in errors before, but the way Saskatoon Health Region handled this error has been incredible to watch. Their openness to understand that there are safety defects in the system and their openness to work with me and to try to fix them have been unlike anything I've experienced in my own healthcare career to this point.
The most important thing that I learned from this whole experience was that, first of all, we as healthcare providers need to talk to each other. We need to be able to listen to the families. If we are in a situation where we're not sure what's going on and we're not comfortable with the situation, we can't be scared to just push the stop button and figure out together what's really gone wrong.
Safer Every Day is a 90-day initiative where we are focused on improving safety for patients and our staff. One of the areas of focus is on team communication. We're really working on how to help teams communicate, including the patient and family, in a way that keeps everyone safe. The other area we're really focused on is how do we support both the patient family, the staff, and the physicians who are involved in events like Logan's, so that they feel supported after the event, that we all learn from the event, and that we work together to put in initiatives or improvements that make our care safer every day.
I was devastated when I heard Logan's story, but I also know that unless we figure out how to work differently and build safer systems, that what happened to Logan could happen again.
Yeah. So I hope this clip, yeah, will open our eye as well. So could you hear clearly just now? Or,
I think
not
the early part.
Not that clear for the first part because it's slow. It's like.
Oh, okay. Yeah, okay. So this story was telling that that the mother who was a pharmacist found out that the infusion of potassium given to the child was too high, yeah, and if it was given, the child could have died, but luckily it was prevented, yeah. So can you imagine if the parents are not in the healthcare, yeah, or was not aware, then the child would have died. Okay, so hospital pharmacists reduce error by 50%. Great or not? Yeah. All right. So collaboration improve health we had a lot of evidence for it already. Yeah, no need to discuss. Okay, and this one paper that we produced in Malaysia. Yeah, so you see my name here. Yeah, it was a long time back actually when we did a study. Yeah, we sent pharmacists, dietitian, yeah, and nurses to the doctors' GP clinics. Yeah, and to meet with the patients, talk with the patients, yeah, every month, once a month, yeah, and we had a very good result actually, yeah. But of course, this is a study, yeah, because we have to pay the pharmacist, and we cannot continue that with when there is no funding, yeah, right. But there are levels of collaborations, okay. The level one, yeah, minimal contact between pharmacists and other healthcare professionals. Okay, so for example, uh, there's minimal contact. Okay, and this level two wide system wide authority to supply medicines. So it means that the pharmacist can supply medicines, yeah, that is without prescription. For example, in Malaysia, you have got anti-diabetic, yeah. I think inhalers, yeah, all the asthma inhalers, yeah. So they are all in the group C, yeah. So in the group C drugs, yeah, even the NSAIDs as well, you can dispense, yeah, all oral anti-diabetic, yeah, they are in group C, so they can be dispensed without prescription, yeah. So this what we mean system wide authority to supply. Again, level 3, reactive advice to other healthcare professionals. Yeah, reactive advice means occasionally. Yeah, so for example, you receive a wrong prescription, then you call the patient, the doctors. Yeah, and then doctor can refer to you. For example, the patients cannot use the insulin pen. Yeah, and then refer back to the pharmacist and the pharmacist teaching. So these are by referral. Okay, reactive advice. Level 4, prospective advice. It means that without referral, yeah, or referral by another, okay, sorry, by referral as well, yeah, prospective advice and or by referral. So it means that there's some collaboration here, yeah, and the fifth one, the highest one, yeah, collaborative pharmacy practice, where the pharmacists have the authority to initiate and modify medicine therapy. Can you see the difference in the level? Yeah. Yes or no?
Yes, sir.
Yeah. For example, now we have got our community pharmacists and the GP and the doctors. Which level are we now? Community pharmacist.
One.
Huh? Level 1, 2, 3, 4, 5. Which one?
One.
Level 1, yeah. So can you just answer without chat, because chat I cannot really read, yeah. There's a some what's just now one person chat, yeah. So level 1, yeah. And then how about the hospital pharmacists, like in the government hospital? What do you think? Which level are they now?
4.
Level
I think
4,
4.
yeah. Level 4, yes. In some hospitals, yeah, they have advice, yeah. They can refer the patients to the doctors, and doctors can refer to them, yeah. Common practice, yeah, in clinical, especially clinical pharmacies. Okay, but I think we have not achieved level 5. Okay, because in level 5, yeah, the pharmacist can change the dose without the doctor's authority, authorization, yeah, can change the dose. Okay, Certain aspect probably yes. Yeah, for example, like warfarin clinic. Do you know what is warfarin clinic? Warfarin MTech. Semester 7 students, you know, right? Warfarin.
Yes.
Yeah. In warfarin MTech, yeah, certain hospitals, the pharmacists are allowed to tell the patients, oh, you have to increase your warfarin dose or lower down. Yeah. But in most hospitals, yeah, what the pharmacists do, yeah, is to check the INR, yeah, and give consultation to the patients, yeah, how to maintain the INR, what to take, what food to take and what food not to take, etc., etc. And when the INR is very high or very low, then the pharmacist will inform doctor and doctor will change the dose. Yeah, so these are still level 4. Yeah, but in level 5, actually the pharmacist can modify the dose. Yeah, in level 5. Okay, probably in certain hospitals, yeah, where the doctors already have confidence in pharmacists, yeah, they will allow the pharmacist to modify. Yeah, of course, this have to deal with the regulation as well. Yeah, because in Malaysia, yeah, pharmacists are not allowed to prescribe yet. Okay, so probably you modify, then you have to tell the doctors, I already modify, and the doctor have to prescribe to change the prescription. Yeah, because it's all based on prescription, right? All right. So, but there are levels of collaboration. Yeah. Okay. So the health outcomes. Yeah. So the determinants of health outcomes are the first, of course, safety. Yeah, and then efficacy, efficiency. Yeah. So efficacy is the effectiveness of these drugs. Yeah, to cure the disease. Efficiency is about money. Yeah. So of course the best is the most cost-effective drugs. Yeah. With the lowest cost, but you have the highest effectiveness. Yeah. Okay. There is also quality of life of patients. Yeah, and the carers, and also prevention and health promotion. So these are all in the health outcomes. Yeah. Right. So what are needed for good collaborations? Actually, I wanted to do the word cloud again, yeah, but I think we want to save time. Too much of this word cloud nanti tak habis, yeah. So probably to save time, can you just discuss what are needed, then I can type it here. So some of you can answer me. What are needed for collaboration? What do we need to collaborate?
Depth knowledge.
Yeah.
Knowledge.
Knowledge. Okay, knowledge. What else?
Communication.
Communication. Okay, good. What else?
Understanding
Understanding. Understanding of what?
of the patient's case.
Huh?
Of the case of the disease.
of the disease. So it's like knowledge lah. Yeah. Same with knowledge or
Maybe
not? Huh?
Different.
maybe needs of patient.
Patient's needs, yeah. Understanding of patient's needs. Okay.
Similar
Okay, what else?
therapeutic goal. Similar therapeutic goal.
Willingness to be open-minded.
Willingness to collaborate also, yeah. And open-mindedness. Okay, what else? I'm listening.
Good
Teamwork skills.
Teamwork skills. Okay, good. What else? Anything else? What else, please? Habis. Dah habis, ya. Amuta, Kishantini, these are all SEM 5, yeah. I'm quite familiar with the names. Victor is SEM 5, I know. Iza, Afik, are you SEM 5 or SEM 7? Afik Ashraf.
7.
7, yeah. So do you have any addition idea?
Cooperation.
Cooperation. So cooperation. Yeah, so cooperation is collaboration, yeah, but what needed for a good good collaborations? What do you need? Yeah, somebody answer.
Management
Jessica?
skills.
Management, okay. Management in terms of what, yeah?
In terms of running an operation,
Mm-hmm.
running a task.
Okay, so under the management overall, yeah. So the teamwork is there, right?
Mm-mm.
Yeah. So
Yes.
anyone want to add?
Me, sir.
Yeah.
Be a good listener.
Huh?
Be a good listener.
Listener. Okay. So listening. So where there's a communication, so you have to have a good listening and speaking also. Yeah. Yeah. Otherwise, you only listen. You don't never speak also. All right. So, do you think you possess everything already?
Good judgment.
Good judgment. So where it is? Good judgment. What is that good judgment? Yeah. Can I say clinical skill?
Yes, also okay.
Yeah. So rational judgment and all this, right? So, do you think you possess everything already now, or not yet? Can we address all this in the university?
Yes.
Yes or no? Yeah.
Yes.
So
Yes.
I think 80 to 90% our university we address knowledge, right? That's why you have exam, yeah, knowledge, yeah. But more and more we also focus on communication, understanding, etc., etc. Yeah. But the first is knowledge. Okay, you can have good communication, but if you don't have knowledge, what will happen? What will happen? You have good communication but no knowledge.
No outcome.
Yeah. No outcome, but can the outcome be dangerous or not?
Yes.
Yes, yes.
Yeah, you see whatever these people apa namanya yang the MLM, you know what's MLM, right? Multi-level marketing, right? Diorang, so this they are very good in communication, right? So they apa namanya persuade the consumers to buy certain vitamin, very expensive, yeah, supplements. And do you think all what they have um, they said to the consumers are all correct or not? Accurate or not?
Not accurate.
Yeah. Yeah. So these are the example when you have good communications probably, but you probably will use it wrongly. Yeah, if you have wrong knowledge, right? So all these are important, okay? And all, so you have knowledge but you cannot communicate. How? If you have knowledge but you cannot communicate, what will happen?
Communication breakdown.
Yeah, so what will happen?
Patient's health will be in danger.
Yeah, so you do not achieve your purpose, right? You know, but you just keep quiet. Yeah, so that probably will also be dangerous. Yeah, when you know something but you keep quiet. Okay, let's say you know somebody is going to fall and then you keep quiet and he or she fall down, then you have, yeah, although you didn't directly cause him or her to fall, but by keeping quiet you actually, yeah, cause him or her to fall, right? So the determinants of collaborative practice, yeah, they are: first, we need understanding of roles. Okay, so just now somebody said understanding. I don't know who. I think Kogilan ya, or Kogulan ya. Understanding roles, like the doctors have to understand pharmacist role, and pharmacists need to understand dietitian role. Dietitian need to understand physiotherapy role. Only they can refer, right? They can work together. Without understanding roles, we can't work together. Agree or not? Yeah. And then you have communication, very important. Professional stereotype. Yeah, do you know what is professional stereotype? Yeah, stereotyping is when you have preconceived idea of a profession. Yeah, so let me ask you frankly, yeah, what do you think of medical students? Do you have many medical students, friend? Because in MSU you have medical faculty, yeah. Do you have many medical students, friend? Yes or not? Huh? Fida?
Yes.
So are you?
Yes.
So what do you think of them?
They are regular people just like us.
Okay, but probably you yourself not so regular. You belong to the quite outspoken person. Yeah, so probably you think of that. But how about the others? Who are more outspoken, the medical students or pharmacy students? Hello.
In my opinion, I think medical students are more outspoken, sir.
Medical students more outspoken, yeah. So I can feel the difference, you know, because Miss Nt told me, oh yeah, probably our students not so outspoken. I said all pharmacy students are the same, yeah. Whether it is in Monash, IMU, because I used to teach in IMU as well, yeah. Segi, UCSI, yeah, all the same, yeah. Pharmacy students are quiet in the class or online, even worse, yeah, quiet. But if you teach medical students, yeah, they are very forthcoming, yeah, and then they can also correct you when you make mistake, Yeah. So that there are difference. Yeah. But any of you think medical students are macam sombong? Yeah, arrogant? Ada tak? Just jujur je, jujur. Yeah, be
No
honest.
one thinks that. Allah Akbar.
Huh?
Kind of.
No.
No, we don't even talk to them. What?
Vida said kind of.
Sorry?
Vida just now said kind of.
Kind of. Okay, kind of. Yeah. So, how about doctors? What do you think of doctors? Are doctors more
Depends on the
serious?
doctor.
But when you
I mean,
think about doctors, when you think about doctors as in general, do they give orders or they listen to people?
give more orders and not listen to people.
Okay, good. So just now, but Putri answered, but a male voice. You are together, is it?
What?
No?
No, no, no.
No, okay. Sorry. Maybe I saw wrongly. Okay, so in general, yeah, doctors give orders, right? Of course, we have many humble doctors as well. Yeah. In my professional practice, I have met many humble doctors. Yeah. But also doctors who initially fought with me a lot also. Yeah. But after that, we became good friends. Yeah. And then medical students. Nah, I have this experience. Yeah, I don't know whether you agree or not. Yeah, so because before I joined Monash, I was from IMU. Then for a while I was teaching in Segi, maybe for 2-3 years. Yeah. So what happened was Segi has got this pre-U, yeah, pre-U, like what you call pre-U, A level, something like that, pre-U, yeah, or foundation, yeah. And then this medical and pharmacy are the same, right? Foundation in science, yeah. They study in the same class, yeah, and sometimes they also stay in the same hostel, yeah. And then when they studied medicine, and some already go to medicine, some go to pharmacy, they never met each other. They never talk to each other. They never make friends anymore. Yeah, as if they are no friends at all. Yeah. Then one day I make a study together. Yeah, what you call IPE. Yeah, Interprofessional Education. PBL together. We mix pharmacy and medical students. Yeah. Then after they study together, yeah, because actually pharmacy and medicine in Segi, they are the same floor, yeah, but in MSU different floor, I think, yeah. In Segi they are the same floor. So pharmacy a bit when you go to medicine a bit at the back, you have to pass by pharmacy, and same corridor, you will walk in the same corridor, yeah. And before that, I never saw pharmacy and medical students talking in the corridor. Ya, when they met each other, dia macam tak kenal. Ya, langsung tak kenal, tak pernah berborak-borak, tak pernah. Ya, and then after this PBL I saw some students talking in the corridor, kan? And then I asked them, "Hey, you know each other, ya?" Then they said, "Of course, we were friends before in the apa namanya, in the pre-U, ya, foundation." Okay, so I said, "Oh, why I have not seen you talking before," right? So this is some of the my experience, yeah. So the students themselves, when they already in their professions course, they already being segregated, yeah. They also develop some what do you call, stereotype, yeah, thinking, oh, medical students must be lah proud, ya kan, must be lah sombong, ya. Nah, all these are stereotyping, okay. And then complementarity, yeah, knowledge and skills and communication. All right. So actually, there's a film about clinical pharmacy, but I think we should not. We don't have time to play it. I will give this slides to you after this. Yeah. So you yourself can watch it. Okay. How many more minutes we have? 10 minutes. Yeah, I think. Yeah. Yeah, 10 more minutes. Yeah. So we better be quick. So of course, clinical pharmacy development a lot already, yeah, even in Malaysia, yeah. But in this clip, you can see, the good thing in this clip is that there's appreciation from doctors and nurses, yeah, about the pharmacists, yeah. Please watch it by yourself, okay. Then there's another one here. In US, they developed this, yeah, clinical therapy, medication therapy management, MTM, yeah, where pharmacists working, yeah, in community pharmacies, the community pharmacies, yeah, can handle patients of diabetes, hypertension, yeah, all these chronic illnesses, and then they can collaborate. So with the some protocol, there's a protocol, yeah, when, for example, if HbA1c is high, suggest to the student, to the patients to, for example, uh, recommend changes of drugs, etc., etc. These are all MTM, yeah. All right, and then you have got another one. Now, in the UK, they actually have primary care pharmacists. Yeah, what are the primary care who are the primary care pharmacists? Primary care pharmacists, they work in GP clinic. Yeah, so the different with MTM, they work in community pharmacy. Yeah, but primary care pharmacists, they work in GP clinic. Can you imagine pharmacists work in GP clinic? Yeah, so what they do almost, I think it is good to watch this only 3 minutes. Can we watch this, Miss Anty? 3 minutes, yeah.
Yes, yes, can.
I hope we can have clear sound.
I'm Elizabeth Albright. I am a GP and surgery in Stafford, where I've been in practice since 1980 when I joined as a partner. We're a multidisciplinary practice. We have about 10,500 patients on our list, and we also provide an elective triage service. About 3 years ago, we had an employed doctor working with us who decided to move on, and we wanted to review the way we structured our practice team. Instead of taking on another doctor, we took on an advanced nurse practitioner and a clinical pharmacist. The idea of the clinical pharmacist being that she would be available to do routine medication reviews, which would take up a disproportionate amount of our time, leaving us free to see the patients and the doctors.
My name is Dr. Manam Singh, and I'm a clinical pharmacist. I run clinics around hypertension, and I particularly specialise in managing those patients who have high complex blood pressure. Some of the benefits that patients may get from seeing a clinical pharmacist is they may feel more comfortable speaking to a clinical pharmacist. We have to take a holistic approach when looking at their medicines, not just the medicines which we are treating, but all the medicines that they have. One of the key benefits for a GP practice is by having a clinical pharmacist, you build up a multidisciplinary team, which is great for the patient.
I'm Shalini Agarwal. I'm the practice pharmacist and lead in mental health. In my 15-minute appointments, I feel that I have more time to talk to the patient on various issues. For example, side effects. We can talk about risks and benefits, adverse effects, any interactions they're having, or any other medication they're having that is not listed on the prescription.
We are highly qualified. We have a good understanding of medicines. And as clinical pharmacists, we are used to seeing patients and treating long patients.
With the pharmacist, I felt like I had more time, which I found is better because you don't feel rushed. You feel like you've got more time to ask about medications and is this right for me? Is that right for me? I'd recommend it, and I say to me, it's just the same. The knowledge is just as good. They know about the medications. Sometimes you might find them know more about medications being a pharmacist. I think the NHS English pilot is a really good idea. People often don't think of including clinical pharmacists on practice teams. It's quite a new idea. And they don't realise the enormous benefits that they can derive from working with them. Given the opportunity to try this out, I think they will realise that a clinical pharmacist is a really valuable member of the team who will be delighted with working with them and will want to continue it.
Okay. Can you hear clearly just now? Ya, so the UK, Madam NT tolong ini ya, screenshot untuk kita ya. Sudah screenshot belum? Untuk absen apa? Untuk
Attendance?
ya,
You mean attendance?
ya.
Okay, then.
So in Malaysia we have got MTech ya, medication therapy and adherence clinic ya, since 2004. I believe since 2004. So almost 20 years already. So the MTech really boost up the pharmacist service in the hospitals, and these are good things that the pharmacists systematically and regularly follow up the patient through this MTech. I think this is a very positive thing. But MTech, of course, now MTech focus on counseling. Focus on counseling, the use of medicines. But not yet pharmacists not yet practice. The teamwork is not yet level 5. This is still level 4, but it is something good. Something good, which we hope that it will level up to level 5, where pharmacists will have more independency, more autonomy. But of course, we don't want, in the collaborative practice, we don't want autonomy 100%. We have to have, of course, have to have collaboration. All right, and then okay, so do you think it is important to educate the pharmacists and doctors, the nurse, the medical students and pharmacy students together? Yes or no? Yeah. So we have got IPE. IPE is occasions when students from 2 or more professions learn about, from, and with one another, each other, to enable effective collaboration and improve health outcomes. Actually, WHO said that before you can have collaborative practice, we supposed to have IPE first. Suppose that the students learn together first. So when they learn together, they will know that they have different knowledge, and they will have different skills, that they can collaborate in order to improve health outcomes. Okay, so challenges of collaboration. What are the challenges of collaboration? What do you think? So we have got lack of knowledge of others just now. Lack of confidence. Do you think that pharmacists and pharmacy students very often lack of confidence? Okay, professional resistance, reluctance from the maybe from the doctor's part, and also from the pharmacist part, reluctance to go ahead, to tell the doctors, never mind lah, like that. So the never mind attitude, never mind lah, like that. So the reluctance, also reluctance come also from the financial part. So since we are not paid to do this, why should we do this? Just dispense lah the medicine, no need to have any counseling. We are not paid for the counseling. So that is also one drawback. Okay, and then we have got other commitments. Pharmacists got a lot of commitments. Many meetings. We go to hospital, you say that, can I see the chief pharmacist? Meeting. Kalau kita ada pharmacist like clinical pharmacist, we have got outpatient pharmacist, inpatient pharmacist. We also have meeting pharmacist. Meeting terus, okay. So we have got lack of incentive. Just now I mentioned about incentive, and then others. There are so many other challenges, for collaboration. Okay. So about the IPE, what are the challenges? Lack of willingness. Yeah. Now I ask you, let's say now we say that I know that MSU is going for IPE, yeah, but I don't know how the implementation now lah. Okay, with the COVID. Okay, before that, MSU actually aim to have all the like patient safety lectures and all these are IPE, yeah, headed by Prof. Nabisha. Okay, but I don't know now, yeah, what is the plan now? Okay, but I ask you all first, the pharmacy students, are you willing to learn together with medical students?
Yes.
Yes.
Siapa yang bilang no? Anybody? All right. So, but in my experience, yeah, so they are pharmacy students normally are very willing to learn from medical students, yeah, because they said that medical students have more knowledge. We can learn from them, yeah. But the medical students normally feel that the IPE is like a waste of time, yeah, because the medical students feel they learn less from pharmacy students, yeah. Although to be polite, they said yes, yes, yes. We learn from pharmacy students how to, do a medication review, etc. But many of them actually feel it is a waste of time, yeah, because the medical students they also learn pharmacology. Don't forget, yeah. They think that they have better knowledge of physiology, anatomy. Yeah, they also learn pharmacology. You know, one in Monash, yeah, we have got large scale of IPE in the first year and second year students, yeah, and then we always have like a PBL together in Monash, yeah, and large scale, yeah. So one PBL can be like 500 students. Okay, we have done that, and then in the PBL, okay, one of the PBL normally because the coordinator for IPE in Monash is me, so I will choose the topics that the pharmacy students have learned. Yeah, so that there's one semester we choose asthma, where the pharmacy students just learn 1 week before. Yeah, and medical students maybe learn it long time back, so they have forgotten something like that. Yeah, so when they mix together, and then the pharma students seems very good, yeah, in inhaler technique, etc., and the medical students were so amazed. Wah, pharmacy students so good, right? One apa 1-0 lah orang cakap ya. So so pharmacy students like above like that. The second semester we choose the DVT, yeah, deep vein thrombosis, and the pharmacy students have not learned that particular topic, but the medical students they have learned in the last semester before. So what happened? Of course the medical students got a lot of knowledge, yeah, and even they can remember the coagulation pathway, so, the coagulation pathway, yeah. And the pharmacy students were like, huh? Like that, yeah. So they were like discouraged. How come we don't know anything? The medical students know a lot of things, yeah. So these things, when we do IPE, it will come out, right? And then this is the occasion for me to say, yeah, like what your friend said just now, we are expert of drugs, right? But don't say you are expert of drugs if you don't know anything. Yeah, so many things we don't know. Yeah, I myself don't dare to say that I'm expert of drugs. Yeah, very far behind. Yeah, if you ask me a drug, for example, like cancer therapy and etc., I won't be able to if it is not in my scope of practice. Okay, lack of knowledge how to start, yeah, crowded curriculum, etc., logistic problem, yeah, lack of funding. Okay, yeah, so these are the competencies that we need, yeah, values, ethics, role and responsibility, IT, communication, teamwork. Okay, I think the rest actually about IPE not so important, yeah. So we have got IPE models, classroom based, yeah, workshop, problem based learning, and case based, yeah, simulation based, practice based. These are where I normally take the students, yeah, in the ward, yeah, the medical nursing students, and I have my pharmacy students, yeah. And then competition based, I have done this competition based, yeah, where we have competition, yeah. This one is in Melaka Manipa, yeah, with inter-university, interprofessional, okay. And then we have got social activities as well that you can, yeah. So these are the some website that you can go through, yeah, resources, okay. So these are the my last slides. Do you have any question or comments? I add my email first.
No question.
Any question or comments, please? Do you think this useful or not?
Yes, useful.
Kagulan, thank you, Kagulan. But how about others? Yeah, why so quiet? Yeah. Can I see everyone in the video, please? Everyone in video. So let me introduce you. We have got Madam Rizky here. She is the head of the dean of pharmacy, yeah, in JGU. Hello, selamat pagi Bu Rizky.
Selamat pagi, hello everyone. Nice to meet you.
Okay, and then I stop recording first. Yeah.